This is Shelley Kraft coming to you live on SNN Live. We're at the Dawson James Small Cap Growth Conference 2016 here in Jupiter, Florida. I have with me Mark Emelfarb from Dyadic. It's a publicly traded company, and the symbol is DYAI. Mark, welcome back to SNN Live.
Thanks, Shelley. It's always great to see you.
It's good to have you. Let's get into it. I haven't seen you in a while, but I want to start out with an overview of the company, and then we'll go from there.
Great. So Dyadic International is a biotech company that has developed a method to be able to make proteins at very large scale at very low cost. We started out in the industrial biotech space, making enzymes for animal feed, food, and biofuels, and have sold that division to DuPont for $75 million on December 31st, 2015. We're now applying that technology to be used to develop and produce biologic vaccines and antibodies in the biopharmaceutical space, which is a multi-billion-dollar industry. Certain drugs like Humira, which is a $14 billion drug, and biologics make up about 21% of the pharmaceutical industry today. There's about $1.3 trillion worth of drugs being used today, and about 270 million of those are biologic drugs, and it's the fastest growing segment of the biopharmaceutical industry. And in fact, it's an unsustainable model because patients can't afford them, the healthcare system can't afford it, and third world countries can't even get these drugs because they're too expensive. And we are trying to work on a way to bring the cost down, the volumes up, and greater access to patients worldwide.
How was it done before your new developments in the biologic area?
Well, today and for the last 3 decades, they've been using Chinese hamster ovaries to make a lot of these biologic drugs. CHO cells are called CHO cells, CHO cells. CHO cells are really not made to produce biologics, but they've been able to modify them over the last 3 decades and continue to improve them to a certain point to where they can make them, but they're very expensive, they grow very slowly, and our technology, we believe, will be able to make them at 5 to 10 times larger yield, so more quantities, and half the time with a lot less cost. And so it's kind of like driving a Model T Ford, and now we're driving a Ferrari.
So technically, would you say this is disruptive technology, and if so, why?
Well, I believe it's a game changer. I think that synthetic biology, genomics, biotechnology has advanced faster than Moore's Law did in the computer industry. And applying what's being done today, and yet let alone what's going to be done tomorrow in the near future and even several years down the road, to this really prolific cell line that we've created to make large volumes of low-cost proteins, changes the game in the way biologics can be developed and produced. Not only in the terms of cost, but in the terms of CapEx savings. So it's not just OpEx, the operating expenses, it's the capital expense to build these massive plants and the hundreds of millions of dollars that are needed to build those plants. If you can make things at 10 times the scale, at 1/10 the cost, and half the time, at 10 times the yield, you got to use a lot smaller fermenters to grow these things. So we believe that with the advances of the science that we've made over the last 2 decades on this technology in the industrial world, being applied to this inefficient pharmaceutical industry, that we can change the game in the way vaccines and antibodies are developed and produced, and bring the cost of healthcare down for society, make it more accessible for more patients, where they can pay less and have access to drugs that are unaffordable.
Let's talk about the industry. Let's talk about the adoption of the new technology, and let's talk about the overall size of the market.
Well, the industry is very conservative, and that's probably the biggest risk to all of this is we believe the science is there to execute on what we're doing. That's time and money and good science, and there's literature demonstrating that we can modify these supercells to achieve the goals we're aiming for. The industry is so embedded with these CHO cell technology and are so adverse to change, and in some ways in a good way, because of course these are drugs you inject into people's bodies. But the bottom line, it's kind of like staying on a horse and carriage or a Model T instead of going to a Ferrari. And
that's less expensive.
It's quicker, it's faster, it gets you to where you're going in a much shorter time, more reliably. So we believe that the advances in science coupled with the advances we've made over the last 2 decades on the industrial biotech sector, and in specific to our C1 technology and the cells we've created, which are hyper-producing cells, we'll be able to change the way drugs are developed and produced.
How do you change the mindset of the industry?
Well, the good news, it's not just us trying to change the mindset, it's the government, it's an unsustainable model. The world cannot afford healthcare today. And these biologic drugs make up about 21% of a $1.3 trillion global spend on drugs. So this 21% of the biologic drugs, things like Enbrel, EPO, insulin, et cetera, these drugs are the most expensive drugs. People can't afford them. The healthcare system can't afford to pay them. The payers in the healthcare system are looking for generic versions. They're finally coming off patents, which is very important. So we have things called biosimilars, or like a biogeneric of a biologic. So if you can just imagine that, like the generic drug industry in the past, when you make a chemical drug and a generic, 2 + 2 always equals 4, you get the same output. Biologics are all driven by yield. And we come from a world where yield means everything. The industrial biotech space, if you couldn't make things in large volumes at a very low cost, you're out of business. And we've developed one of the most productive ways to make biologic molecules, proteins, at large volume at low cost. The beautiful thing here is we're going to be able to scale down. We've run at 500,000 liter scale. The largest CHO cell plant, which is the way they make things today, is 20,000 liters. So we've already run it 25 times that scale successfully. The difference here is we're not even going to run at 20,000 liters. We're going to try to bring, because of the higher 5 to 10 times higher productivity in half the time that we can run, we're going to bring that down to a 2,000 liter or 1,000 liter scale facility. So either 1/10 or 1/20th the size. And that means the CapEx, your investment in capital equipment to produce these biologic drugs, is a huge savings. It could be several $100 million per plant in savings, let alone the OpEx costs. So if all this comes together and we achieve the objectives and the goals of what we're doing and the science comes in, that things like CRISPR and other incredibly powerful technology that are just coming to play, this is going to make a difference, and it's going to be allowing the world to get affordable medicines globally, not just in the West, even in the third world.
Where does the FDA come into this?
Well, the FDA is going to be a critical component to all of this, as are the regulatory agencies all over the world. The nice thing is that biosimilars, these biogenerics, are already starting to be sold in the U.S. They've been in Europe for a decade. They're taking 15 to 20% of the market already. And the thing is that people thought that these biosimilars were going to come in at about 80% of the price. With the competition, it's not like we talked about synthetic chemistry where 2 + 2 is 4 and everybody's on an equal footing. He who can make large volumes of proteins cheaply is going to rule the space. And we believe we can deliver upon that. And the FDA, of course, is going to have to approve all this technology to safety. But we have initial data from our industrial business where we created food and feed enzymes using this technology, where we have GRAS recognition from the FDA on pathogenicity safety, endotoxin safety, all these other things. And in some ways, the cell line that we have, the C1 cell, is a filamentous fungal cell that's been modified over 2 decades to produce in a unique way. We'll start out with an advantage because CHO cells, you have prions or viruses that are made if it's made the wrong way. Fungal cells don't have that, so the purification should be easier, should be less costly, and so the FDA should embrace new technology because in the end, it's all about sustainability for the public. And we're already complaining about healthcare costs are spiraling out of control already, let alone what they're going to be when more and more, we're getting older, more and more people need these antibodies like rheumatoid arthritis, et cetera. So if we don't change the game in the regulatory rules, the patients and the healthcare system are going to suffer and go bankrupt. And we want to keep that from happening.
Let's get your website out there for more information, Mark.
For information on Dyadic International, go to www.DYADIC.com.
Ladies and gentlemen, Mark Emelfarb, Dyadic. It's a publicly traded company and the symbol is DYAI. I'm Shelley Kraft. This is SNN Live, and we're coming to you live from the Dawson James Small Cap Growth Conference 2016 right here in Jupiter, Florida. Mark, it was good to see you.
Shelley, it's always great to see you.
And thanks for coming on.
Thanks for having me.